Namaste and welcome to Youth and Development, produced by Today's Youth Asia. In the TV show Youth and Development, we bring young leaders face to face with the key players of development works. My name is Aina, and in today's episode we are featuring an interactive panel discussion between the young participants, members of the Parliament, and policymakers on adolescents, sexual reproductive health needs, and its policy implications. The interaction was a part of Regional Consultation with the Parliamentarians and Policymakers on family planning and reproductive health needs in South Asia. It was organized by ICOM in collaboration with SAARC Secretariat, Kathmandu, and Population Association of Nepal. It was supported by David Lucio Pakyar Foundation, USA, and AFPP, Bangkok.
Good afternoon and welcome to all of you. I'm Naresh Phuyal, a radio journalist from Nepal. And today we are having an interactive panel discussion here. This is the dialogue of young people with parliamentarians and policymakers with the theme, Adolescents, Sexual Reproductive Health, Needs and Services and its Policy Implications. This is in part with the ongoing regional consultation with parliamentarians and policymakers on family planning and reproductive health in South Asia, addressing the challenges. This has been organized by ICOMP in collaboration with SAARC Secretariat, Kathmandu, and Population Association of Nepal, the PAN, and supported by the David and Lucille Packard Foundation, United States, and AFPPD, Bangkok. So I have the honorable panel members here who are gathered here, and I would like to just introduce with this gathering. We have Honorable Ms. Golalai Nur Safi, Member of Parliament from Afghanistan. We have Honorable Mr. Chencho Dorji, Member of Parliament from Bhutan. We have Mrs. Sonia Samant, Chairman Jilla Parishad, Jharkhand Province, India. We have Mr. Ahmed Mahloof, Member of Parliament, Maldives. We have Ms. Sundas Warsi from Pakistan. Mr. Nazmul Kabir Al Mahmood from Bangladesh. Ms. Anusha Agrawal from India. Mr. Gaz Tamu from Nepal. Ms. Shruti Karki also from Nepal. We have Mrs. Bobby Bhagat. She's a Jilla Parishad member and she's from Jharkhand, India. We have Honorable Sapna Pradhan Malla, CA member from Nepal. And also we have Honorable Ms. Dunia Momun, Member of Parliament from Maldives. We have also my colleague moderator.
Namaste. I think we are here today, which is very appropriate and opportune moment, because it's about when the young people, I think young leaders by their own right from the South Asia region are interacting with the leaders from the South Asia. And I think the primary purpose, Naresh, is about adolescent and sexual reproductive health issues. But I think it's really not limited to just about adolescent and sexual reproductive health issues. I think it's about, on a daily routine basis, the issues that they confront with, the issues that they face. And I think they have lots and lots of questions when we were talking about before this recording. And they really would like to share with the leaders, in the panel, and interact perhaps, as much as possible, and also perhaps, find some solutions, because they had questions which I think it's very difficult. It was very difficult for example, for us to, Naresh and myself, to answer, and perhaps I think you could help. So to start with, maybe we can request our friend from Bangladesh, Nazmul, to please, you have some question or you have something that you would like to share with the panel.
Half of the people of world's population are young people. So how can their voice be ensured in the policy making? Can you explain that?
Half of the people
of the world's population are young.
Yes.
So what way they can ensure their voice in the policy making?
May I request Dunya? our Honourable Member of Parliament from Maldives to start on this.
Thank you very much for the question. I believe that young people need to be more involved in terms of consultation on national policies and plans, and their voices and needs really need to be taken into account when we make our plans for our countries. This is very vital given that there is such a large youth population in the South Asia region, and especially also for the Maldives this is the case. So, thank you.
What you can do for that? We want to raise our voice, so what you can do for us?
If I could go back to the Maldives case, I can give you an example of how youth voices or their sort of views was taken into account in terms of national planning. Some years back, a national survey was conducted. This was entitled Youth Voices, Opinions, Issues and Challenges. And during that time, a representative sample of youth was taken, and detailed discussions were carried out on a range of issues relating to health, and also much more than health, on many, many areas. And the results of this research was very sort of highlighted the issues and the challenges that youth in the Maldives were facing, and this was then incorporated very much into international plans and sectoral plans at that time. So I think this is one way of how we could look at youth views, and using a formal kind of structured approach, include that in terms of our planning needs. Thank you.
If I may interject here, and I think perhaps, if not Dunya, perhaps other honourable members could help us. Maybe I'll request Sapna ji from Nepal.
What I would like to share here is yes, we do agree with your question, because up to now laws and policies are made by one gender, one caste, one class, one age group, and therefore legitimate voice of engaging youth is very much important. But I would also like to give the example of Nepal. If you look at the present structure of the Constituent Assembly, we have the largest population of youth group as a parliamentarian, and which you can also see here in this forum from Maldives, like we have some young parliamentarian here. How we can engage? Yes, merely engaging them in the consultation is not enough. But even that can be one process which has to be respected and practiced. But we are confronting that whether some youth, because even within youth there are different age groups, whether they have that they can give consent, whether their informed choice can be respected or not. And therefore, what we need to also keep in mind that there are mature and emancipated child as well, and therefore they have to deal differently. And secondly, we have to make sure that when we develop a criteria for participating in the political life, in the policy making level, the age limitation has to be narrowed down to the younger people as well. So I think we need to develop some mechanisms so that younger people's voice can be listened and they can participate, and also encouraging youth to participate in youth political organization as well as in other forums.
Right. Thank you very much, Sapnaji. I think this was really, I think it took us a little further in this interaction. Maybe, Excellency, allow me to first, I think, Sundas Vasti, a young friend from Pakistan, I think she wanted to interject there. Yes, Sundas.
Thank you. We have been discussing the reproductive health and the family planning and all the related health indicators of the region. Unfortunately, the figures are not so good, and we're not progressing very fast. We're very low. Talking about Bangladesh, Pakistan, India, we have population programs since years, like it's more than 50 years, but we're not being progressing. My concern is that why we have been not able to utilize the private sector in this family planning services. This is I think there's a huge potential if we invite the pharmaceutical industries and other private players to provide the family planning services, because there are a lot of unmet needs. Those are not met. So if somebody would like to please elaborate why we have not been able to utilize the potential of private sector in all of the countries or in any of the countries.
You know, when you talked about private sector, are you essentially talking about in partnership with the public sector, which is subsidized or under the social marketing, or are you talking in terms of you know, the contraceptive production and distribution?
From two perspectives.
With
Number one, the government can also invite the private sector
Yes.
to work with them for providing the family planning services.
Right.
And secondly, they can themselves intervene into this area, because social corporate responsibility is one of the areas that has been gained attention by the corporate sector organizations. So actually I have been speaking to few pharmaceutical industries through my personal links. From their perspective, nobody actually invited from the government to really help them to understand the industry, how can they intervene, how can they provide services.
In our parliament, we have 72 members, of which over 60% are all youth, all young people. Of course, I am not young. As you can see, my colleague, member of parliament there, she is also young, and we are like her, over 60% of young parliamentarians. So they are elected by the people, so that they are elected mainly by the youth, so that their voices can be heard in the parliament, in the decision-making level, so that it can make a difference for them.
I can share the overall scenario. Actually, in Pakistan, there are couple of pharmaceutical companies or the private players, those are providing the family planning services like contraceptives, condoms and other pills. But those are only concentrated in the urban areas. Nobody has yet significantly reached the rural population.
Yes.
So this is the scenario in Pakistan. I don't know, I want to learn what about other countries.
Ms. Sapna Mala.
Yes, we need to have a public-private partnership. And we also need to be clear, what do we mean by private sector? Is it only private companies or also NGOs? In our experience, for example, I can give you example of Nepal. After legalization of abortion, services are available, but until now, 80% services are provided by private sector, by NGOs. Similarly, though government introduced family planning policy and contraceptives were made available, but it was through the private company and private sector. It was made available in the lowest price and also distributed among the larger community. Therefore, what we all have to keep in mind that we really need to promote public-private partnership if we really want to ensure access to reproductive health, especially to youth group, without which we cannot even make them realize their social responsibility, and also cannot make accessible to affordable, accessible services at the community level.
In Nepalese perspective, I think just quite a month ago, we read in newspaper that in Rukum district, a couple actually died, and their children aged below 10 years. There were 5 or 6 children where they were completely left over. But at that time, some of the journalists, our friends, they asked us that where is our family planning program is there? Always we ask for those children to look after where are other NGOs or somehow like that. But have our program, our family planning program, have they reached to Rukum district or those rural areas or not? These are, I think, the burning issues also in this region too.
Maybe that's one of the areas where private sector can intervene, both NGOs and the corporate sector organizations. Because government alone cannot have reached to neglected or the marginalized population. This is one of the examples.
I think it is a must, as we all know that the youth population is very high among all the SAARC countries. Even as Dunya mentioned, in Maldives, I think we have around 35% below 35 years. Therefore, we do have a huge number of opportunities for youth participation. I believe in that, and as a result, as some of the other MPs mentioned, we have quite a number of MPs representing in the Parliament, which means that the citizens or the people themselves believe the role of young people is important. And while working in the Parliament also, if we are working on a specific bill related to youth, then we always invite young people. Suppose if we work on gang violence or drugs, then we used to get them and listen to them, because they are the people who are involved and also working with them. So I would like to call all the SAARC leaders and the governments to get as much participation of young people, and that would definitely help to move forward.
How many countries in the region have a dedicated national youth policy? Do they have provision for young people's sexual health or sexuality, information on sexuality issues and reproductive health issues?
Actually, I did work with UNFPA. They did develop one such policy with the government for Pakistan.
Right. And I'm sure, as you said, if it was UNFPA, then possibly, a principal component in the national youth policy, for sure, I mean, I would like to believe, would be sexual reproductive health as well. In addition to various other issues.
Reproductive health, sexual reproductive health, all the components.
Very good. Yes, Excellency, would you like to?
Just to add, we also have a youth policy, but in my opinion, I think we should have a law specifically for young people, which would be much more stronger. For us in Maldives also, we don't have a specific law, but we do have a law for young children, kids. But other than that, most of the issues related to young people have been covered in other bills, like in a bill on health, so in different other bills, those issues are addressed, but I think it is much more important for us to pass a specific bill on that. And currently, our party, we are working on one of the bills targeted for young people.
I think we talk a lot about policies and bills and, these issues, but there are many laws in place already. What really bothers me is that, there have been instances where senior political leaders, they have said that if girls are raped at night, why did they go out at night? They're inviting rape. So, this statement is, if I may say so, absolutely absurd. You can't, shirk your responsibilities like that. So we do have laws in place, but I think it's more an issue of weak policing or an ineffective judicial system, which, renders these girls vulnerable, and the, criminals feel that, yes, we can go scot-free. It's not that big a deal. So I think what is it that we can do to, address this issue of policing and the judicial system? The implementation of the laws that are already in place, rather than, expanding the laws.
इनके लिए ये लॉ ऐसा बनना चाहिए कि उनको कठोर से कठोर लॉ बनना चाहिए, उसको दंड मिलना चाहिए कि ऐसा नहीं होना चाहिए.
I think it's a matter of rules and laws. We, all the countries of the region, we do have laws and rules and regulations for each and everything. But it's a matter of law enforcement and the legislation process, which is unfortunately very weak in the South Asian countries, unlike the European countries. In European countries, why doesn't it happen? Because everybody knows that the case is going to file and the results are going to be announced very immediate, and the culprit is going to be punished.
Yes.
In Pakistan, India, or in the Bangladesh, or in our countries, we know that nobody is going to file case because of the legitimate process, legislation that is very prolonged, and you have to appear on dates and this kind of system. So it's a matter of law enforcement. Secondly, respect for law and the legislation process that we are having.
Girls are not raped just because they are weak. They are an unbalanced power relationship. And also the attitude, the mindset, the values, which still considers woman as a commodity. And because even if a girl is not even walking in the night or going out in the night, Even if a girl is wearing burqa or sari, they are being raped.
Right. Yes.
Even a small child, 9 years, 4 years child is being raped.
Right.
Secondly, what we also have to see that, yes, we have to have a strong law that should have a broader definition, because up to now in our South Asia, rape means vaginal penetration. So it has not been able to cover other forms of rape as a crime. And secondly, access to justice is complicated, not only because of the law, but also because of the mindset, stigmatization, and therefore breaking the silence in case of sexual violence is a challenge.
Apart from strengthening policing, I think girls should also take steps towards their own safety in terms of, because it's not going to be possible to have effective policing in all situations and at all times. But saying that, I wanted to just support Sapna in what she said, that it's all about cultural and societal attitude. So there is an attitude that it is all right for girls to be subject to rape or violence depending on where they are, at what time, and whether they're labeled as a particular type of girls or women. So I think this is very wrong, and definitely there's no type of violence that's justifiable against women and girl children. Again, specifically, legislation is very important. I think we need a broad definition, and we need good legislation in place, but not just the legislation, it's the enforcement of the legislation, and really making all the state institutions responsible for understanding that this is a violation of women's human rights that needs to be addressed, and we all need to work on this.
With this, we've come to the end of today's show. Thank you for watching us. We look forward for your feedback. Our email address is youthtya@gmail.com. We'll be back next week at the same time. Have a great week. Namaste.